Well, good evening and welcome everyone. Thank you so much for joining us for another wellness webinar series event with Jefferson Health. My name is Sarah Breckbill and I will be serving as your program facilitator and will present your questions to our experts. Now, did you know that living donor kidney and liver transplants offer several benefits over deceased donor transplants? These include better short and long-term survival rates for recipients, less time spent on a waiting list, and organ responsiveness. This evening, you'll hear from experts at the Jefferson Transplant Institute and learn about eligibility and the evaluation process. Now, April is National Donate Life Month. The Hospital and Health System Association of Pennsylvania's Donate Life Hospital Challenge encourages PA hospitals to increase organ donation awareness and designations within their hospital and community. To learn more, visit jeffersonhealth.org/save-a-life. Well, thank you so much for submitting your questions in advance of tonight, and we'll do our very best to get to as many questions as possible, but may not be able to answer all of them during tonight's virtual event. And finally, due to hospital guidelines and privacy, we are unable to comment on specific cases. Well, without further ado, I want to go ahead and introduce our experts for the evening, starting with Dr. Paula Martinez-Cantorin, Medical Director, Kidney and Pancreas Transplantation, Dr. Jamie Glorioso, Surgical Director, Live Donor Kidney Transplantation, Dr. Danielle Tholey, Medical Director, Live Donor Liver Transplantation, and finally, Dr. Adam Bodson, Surgical Director, Live Donor Liver Transplantation. Well, thank you all for joining us. Before we dive into the questions, I'll give each of you a minute or two to just say hello and provide a little background information about yourself. So, Dr. Martinez-Cantorin, we will go ahead and start with you.
Thank you, Sarah, for the introduction. Good evening, everyone. My name is Paula Martinez. I'm a kidney doctor that specializes in kidney transplant patients. I've been part of the kidney transplant team at Jefferson for over 15 years, since I did all my training in nephrology and kidney transplant here. And I've been recently appointed the medical director for the kidney and pancreas program at Jeff. So I'm happy to be here tonight.
Well, we're excited to have you. All right. Dr. Glorioso, you're up next. Welcome.
Hi, good evening, everyone. My name is Jamie Glorioso. I'm a transplant surgeon here at Jefferson. I did my general surgery training at the Mayo Clinic and my transplant fellowship at Hopkins, and I've been at Jefferson for almost 6 years now. My clinical practice focus is mainly on liver transplant, and then what I'm here to talk about tonight, which is our living donor kidney program. As the surgical director, I care for the vast majority of our kidney donors.
All right. Well, welcome. Thank you.
Thanks.
Hey, Dr. Tholey, how are you doing this evening?
Hi, thanks so much for joining us. I'm so honored to have the opportunity to speak with all of you this evening. I practice medicine all over the country, but I returned to Jefferson about 7 years ago and feel really lucky to be part of such a great transplant team here. I'm the medical director. I'm not a surgeon for our living donor liver transplant program. And I'm very involved with live donation as it's my passion at the national level, involved in several educational and research collaborations, and have really enjoyed the opportunity to bring that cutting edge knowledge back here to Jefferson. I always love talking about live donation. Clearly, it's my passion and by far the best part of what I do in my job. So I'm really excited to share some of those insights with you tonight.
Absolutely. We're excited. All right. And last but not least, Dr. Bodson.
Hey guys, pleasure to be here this evening. Truly an honor. I am one of the liver transplant surgeons, also the surgical director for the liver transplant program. Trained at Jefferson for residency, then went out to UCLA for more training and fellowship, and then was out University of Chicago for a few years and been back at Jefferson for about 7 years now. So great team, live donor team specifically, really wonderful. A lot of passion, I think, in the four people here for live donation.
Absolutely. You can feel it. So with that, let's go ahead into the questions because I know we received a ton. So to start us off, I'm going to kick it off with question number 1. And Dr. Martinez, this one is for you. How can someone find a live donor?
So that is a great question, and it's definitely a process that most patients don't feel too comfortable about, specifically because there's many myths around living donation that kind of prevent, pose a lot of barriers when you think about it. And the transplant center definitely can help clearing some of those myths and help the recipient to be better informed about the overall process and the potential opportunities. But, most people start looking into their direct family members or closer friends, isn't it? In the beginning, it's the most obvious way to do it and the place to start. But actually, we want to emphasize that the recipient should know that the potential donors don't really have to be related at all and don't even need to be a real match. So they don't have to specifically match blood type or anything in particular. So it's really key that the patients think about a much larger network, extended family members, people they may know from church, work, their kids' school, or any other organized group that the patients may be involved with. Those people may know the recipient but not familiar. They're not familiar probably with all the history. And there's also the need to consider complete strangers as potential altruistic donors. So, in order to do that, basically, patients have to let people know about their stories. So they have to know what they're going through, what are the issues that they're finding, that they need a kidney or a liver transplant. And sometimes that's really hard to do, to let people know that you're sick, that you're going through a lot of different stuff. And if the recipients don't feel specifically good about that, they can actually talk to a family friend a family or a friend that doesn't have to be the donor per se, but they can be the donor champion. So somebody who can take that on, from normally as a close family member or a friend, and they can do, the work for them. They can actually bring their story back to everybody. Definitely how you can do that, there's many different ways. We live, I guess, fortunately or unfortunately, in a social media era. So, and that helps for, this type of broadcasting. So if the donor champion is familiar and feels like they can do it, they can use social media. The transplant team can help providing information about, general, living donation, and also the best practices to use social media for broadcasting stories, isn't it? And then there's also other networks that can help. So we participate with the National Kidney Registry. They have a program that is called Microsite, and even the National Kidney Foundation, a program Big Ask and the Big Help. So this is basically a group of people who can help personalize from websites to text messages in order to help donors to tell their stories and ask for help, which is the most complicated thing. So, I think as a sum up, I will say we should look for donors everywhere and anywhere. And the real idea is to think broadly.
Okay, thank you. A lot of helpful information there and opportunities. So appreciate you walking us through that. All right, Dr. Glorioso, this next question is for you. This person is wondering, how does one apply for a transplant or a spot on the list?
Yeah, so in order to be on the transplant list for either liver or kidney, you need to go through a thorough multidisciplinary evaluation to determine if you're a candidate for transplant. So for kidney, to qualify to be on the wait list, you need to have end-stage kidney disease. So you don't necessarily need to be on dialysis, and ideally we'll see you prior to starting dialysis. But you do need to have a kidney function where your GFR is 20 or below to be listed. If you meet those criteria, frequently the nephrologist that's taking care of you will refer you to a transplant center to be evaluated. And then you'll meet with the team and undergo the required testing prior to being listed. As part of that evaluation, we want you to work on finding a living donor while you're getting all your testing done so that we can expedite that living donor transplant as soon as possible. When it comes to liver transplant, it's similar in that you need to have end-stage liver disease or cirrhosis, meaning irreversible scarring of your liver. And not only that, but usually some form of decompensation or symptoms related to your liver disease. So the common things that we see are ascites or fluid accumulation in the abdomen, confusion, also known as hepatic encephalopathy. Sometimes people will have bleeding in their GI tract, or sometimes they'll be really itchy. And then the other main indication for liver transplant is scarring of the liver in addition to a liver cancer. So if you meet those criteria, again, you'll meet with the entire multidisciplinary team ahead of getting listed for your liver transplant.
Okay, thank you. Very helpful. All right. Dr. Tholey, this question is for you. Is there an age limit to be a live donor?
Sure. So there are a couple of different nuances between live donor liver transplantation and kidney. So I'll mention both. For potential kidney, the age limit would be 72. For live donor liver, our program's donor cutoff is 50 to 55. The reason for the difference is really when it comes to the liver's, as the liver ages, its ability to regrow or regenerate does lessen over time. So we certainly want to make sure that we're doing the right thing by both the donor and the recipient. And certainly safety is always the priority. Understandably, it can be really disappointing for a lot of our donors when they hear that they can't move forward with giving this ultimate gift to their loved one and aren't able to donate. But I would certainly reinforce to them that, as Dr. Martinez mentioned earlier, there are still other ways that you can help. I would certainly think about being a donor champion. I always think of this as the personal superhero for the person who's on the liver transplant wait list. You can really get out there, share the story, and be the mouthpiece, so to speak, for them that can help them to then go on to get a donor, even if it can't specifically be you.
Absolutely. An important job. So thank you. Okay. Dr. Bodson, what is the typical amount of time that someone waits for a transplant? And I think you might be on mute.
Sorry about that. It's a tough question to answer because it really is so dependent on where you are, blood type, and organs. So just starting with liver, the average across the US, it's about 240 days on the wait list. But the wait list on the liver side is really based on how sick you are. Whereas on the kidney side, it's based on how much time you've accumulated. And in some cases, of how many antibodies you have to the donors across the United States. So for liver, if you're really, really sick and you're at the top of the list, that wait time in some cases can be 5 minutes. You're put on the list, you get an offer 5 minutes later. But for the people whose MELD score in their lab work, looks much better and they may be at home, they could wait years. So it's extremely variable and also depends on sort of where you live. So if you live in the Philadelphia region, a lot of centers, New York, Boston, we're all competing for the same organs. There's many centers across. So it really kind of pushes, the wait times further out. If you live in Wisconsin, Nebraska, within 500 miles, there's a lot less centers. So things are really variable. For kidney, the average wait time is about 3 to 5 years across the US. But here in the Philadelphia area, New York, the same, somewhere between 6 to 10 years, depending on blood type. So it's a really variable, depending on where you're living, your blood type, and also how sick you are when it comes to liver.
Okay. All right. Before we dive into the next question, just a quick plug for the audience. Feel free to drop any questions you have in the chat as they pop up for you during this discussion. All right. Now moving on to our next question here. Let's talk a little bit about live liver donations. So Dr. Martinez, what is the normal time frame for a live liver donor from start to finish? And when does testing start and what's involved?
So I will actually refer to kidney first, and then maybe Dr. Tholey can actually pitch in and let me know if there's a big difference with our liver living workup. But, for most of our kidney donors, they're relatively young and healthy, isn't it? The testing is relatively simple. Most of the time, it includes a chest X-ray, an electrocardiogram to look at the heart rhythm, blood and urine studies, and a CAT scan of the abdomen to actually look at the kidneys. All of our donors undergo a social service and psychological evaluation they have to have age-appropriate cancer screening. And how we try to do this is we try to basically facilitate all this workup to be done as quickly as possible. So basically, when they are coming here, we're trying to do like a 1 day workup. Basically, they come inside for 1 day. They can meet with everybody, the kidney doctor or surgeon or social worker, the dietitian if they need to talk with a dietitian, uh, and then basically we can obtain the X-ray, the EKG, the electrocardiogram, and the CT scan the same day while they're, after seeing the doctors. Normally, the blood and the urine studies are done in advance, and donors can get them locally. So normally, once we get a referral, we try to get patients or donors, potential donors, a schedule between 7 to 10 days after receiving, the original, questionnaires and their original idea that they will be willing to donate. One thing to mention is that donors can be worked remotely, so they don't have to be physically here. They can be in a completely different state. They can finalize all the lab tests and the EKG, the X-ray, and the CAT scan locally, and then they can physically meet the team when they're actually traveling for donation. So we try to really make sure that we expedite and we streamline the process for them. We can meet them by telehealth before and then physically when they're coming here. Testing can start as, actually if there is a recipient who is coming to get evaluated for transplant and there's somebody in the room that could be a potential donor and they express their intention, we can actually even start with some blood tests the same day. They can meet our living donor coordinator and start the workup at that point. So again, we try to streamline it. If the patients are slightly older or they have any other comorbidities, they may include a couple of extra tests. But for most of the our donors, it's pretty streamlined and a quick process.
Okay. And Dr. Thole, feel free to talk us through the liver donor.
Sure. I think that we have a lot of overlapping similarities in our process. For liver transplantation, a little bit different than kidney. Kidney is lucky, if you will, to have two kidneys. With liver transplantation, we have to segment or cut the liver in half, so to speak. So a lot of what we do has to do with very careful measurements in terms of the size of the liver and the volume to make sure that both the donor who's giving up a piece of their liver and the recipient who's receiving it have enough liver to regrow after the surgery. So because of that, we do a bit more imaging. We do a CAT scan as well as an MRI. And those have to be carefully reviewed to make sure that the volumes are okay to proceed. In terms of other testing, it's a little bit different than kidney. We sometimes need to do a liver biopsy. That's not for every patient. I would say that's for the minority of cases, but certainly if the lab work shows that the liver tests are elevated in the donor, or there's any concern that the donor themselves may have underlying liver disease, that's something that we have to be careful about excluding before we move forward for the safety of the donor and for the recipient. Other differences in our process, there are a couple other consultants that we have all of our patients see. All of our patients see a psychiatrist. Otherwise, the team is pretty much the same, I would say. We really try to work hard to make things as easy as possible for our donors. We realize it's hard, it's time consuming, and what you're doing is absolutely amazing. So we'll do whatever we can to make it work for you at the end of the day. We're happy to see people over telehealth. We work with out-of-state donors all the time and have done a number of donors from Oregon, Alabama, and certainly we are happy to group testing and make it as easy for you as possible.
Okay, thank you. All right, Dr. Gloria, so we will turn over to you now, talking a little bit about recovery. So how long is recovery after being a live donor, maybe for a kidney transplant, if you could talk us through that?
Yeah, so I would say the one thing my donors always tell me is that the recovery was so much easier than they thought it was going to be. In general, most kidney donors spend 1 night in the hospital, so it's a relatively short hospital stay. By about 2 weeks, they're feeling pretty good. They are up walking around. They're usually driving again by 2 weeks. I've had people that have gotten back on the treadmill that are really avid runners by the 2-week mark. For most people, when they leave the hospital, they don't need any pain medication stronger than Tylenol. And usually by a week, they're not taking Tylenol at all. By 4 weeks, they pretty much can go through the day without having any discomfort whatsoever, kind of get to the point where you forget you had the operation. But for a full 6 weeks, they need to refrain from doing any heavy lifting, just because the risk of developing a hernia at the incision where the kidney's removed through. So for most people, they end up returning to work sometime between the 3 and 4 week mark. I've had people go back to work as early as 2 weeks. And then for our donors that have more strenuous jobs that are really physical, oftentimes they'll need to take between 6 to 8 weeks off because of that lifting restriction. Obviously, taking that amount of time off from work can be a challenge financially. And we're really lucky that we have programs in place to help to support our donors with wage reimbursement, travel reimbursement, as well as for anyone that has childcare or elder care, there's reimbursement for that as well. So, as Dr. Tholey was mentioning, these people are heroes. They're really doing amazing things to come forward to save someone's life, and anything that we can do to minimize, the challenges that may come along with having to go through this process for them, we try to do.
Absolutely. All right, thank you. And Dr. Tholey, along those same lines, we also received a question that says, I've been told that the living donor has a very hard time recovering from the procedure, which is why I am afraid to ask. Can you just talk a little bit more about this?
Yeah, sure. So I think, there's really two parts to this question. One is kind of what does the recovery look like on the live donor end? And then also, I think from the recipient end, how do I ask the question, which Dr. Martinez talked a little bit about earlier. In terms of recovery on the liver side of things, the liver does regrow and regenerate pretty quickly. It's actually pretty amazing. Within a couple of months, about 90% of the liver has regrown. And then it takes, the better part of another 6 or 7 months to put the finishing touches on the masterpiece, so to speak. However, that process is really tiring for the body. Everybody's recovery journey looks a little bit different. On average, I would say most donors are out of the hospital within about 5 days, back to work within about 6 to 12 weeks. If you have a desk job and have the opportunity to work remotely, usually can be back to work within about 4 weeks, I would say. But if you have a more active job, something that involves physical labor, you're probably looking more at the 12-week mark. I've talked to a lot of donors over the years about, what was most shocking about the recovery to them. And, I would certainly echo a lot of Dr. Glorioso's comments that the recovery itself was a lot easier than what they expected in terms of pain and getting back on their feet. But really the fatigue is the thing that surprised them, and the fatigue tends to linger a little bit longer. However, everybody did get back to where they originally were in terms of feeling normal from a fatigue standpoint, certainly. On the flip side of the conversation, how do I go about asking my loved one? I think that's a pretty natural thing. And every potential recipient who's been thinking about live donation has said to me, oh my gosh, this is such a hard ask. How can I possibly approach my loved ones? And I just want you to know you're not alone. I think that's a normal, natural part of this process. I can also tell you that all of our recipients who now have a live donor said that to me at one point in time and are happy with their decision. I certainly would encourage you to ask us all of the questions. We're happy to hook you up with some of our live donors, to chat with them about what things look like. I think hearing it from other patients certainly goes a long way. In terms of making the ask, as Dr. Martinez mentioned earlier, I think starting with your close family and friends who perhaps you feel more comfortable talking to is a good starting point. For those of you who are really nervous about this, sometimes writing it down is a good way to do it. I've had lots of patients write a letter, crafting a narrative. And this is where I think the donor champion is so helpful and important, is you can even have the donor champion write it, or you can write it, but have the donor champion kind of sign it as from them. So it takes some of the onus off of you, just kind of explaining, here's what's going on with my health. I need a liver transplant. Jefferson has recommended that I need a live donor. Here's a little bit about what live donation is. Here are the criteria, and we can help you with all of this. And then even including the link of how you access our resources. And then you're able to send that letter out to many, many people. So it's a little bit of an investment up front. Perhaps it takes you an hour or so to write the letter, put it together. Our coordinators, are happy to review these all the time, and they do that, routinely. And then you can send it out to a much larger audience. So I think it's a worthwhile endeavor and takes the onus off of you a little bit in terms of feeling like you're in somebody's face and asking. Certainly somebody can read it. And if they're interested, apply. And if not, they're, welcome to put it to the side. So I would think about a letter. I also would consider the idea of a microsite or a social media post. That's another good way to get the information out there in a way that's a little bit more of a non-threatening ask.
Absolutely. Some great ideas. Thank you. And along the lines of recovery, Dr. Bodson, if there's anything you would like to add from a surgical standpoint.
Sure. I think Dr. Glorioso and Dr. Tholey kind of covered, actually, Dr. Tholey covered the liver side pretty well too, but it kind of goes in the same lines of what Dr. Glorioso said. You can be back on a treadmill. A common question for some of the folks, when I used to do a kidney donation as well, is that, I'm a marathon runner. Can I go back to running marathons? I always say if I wouldn't do it myself, I wouldn't recommend doing it. And I think a big part of it is that I want all the donors to be able to get back to doing exactly what they did prior. So whatever they did before, they should be able to do again. Honestly, by 6 months, you probably can be back, training for a marathon. It's pretty simple from my standpoint. No heavy lifting greater than a gallon of milk at 6 weeks, no swimming or bathing. Shower can be the minute you get home. You could be in the hospital. You can ride a bike. You can run on the treadmill. So the limitations are pretty liberal, honestly. You can get back to driving once you're not taking pain meds. So it really just depends, and everyone recovers differently. There are people who are really taxed. Dr. Tholey mentioned the regeneration of the liver really sucks up a lot of energy. So some people are, taxed for a month to 2 months, but I can tell you, we did one couple weeks ago. I mean, I saw her 7 days after, and she, looked like $1 million. So it's very unique to each patient, but the reality is that we wouldn't recommend this if we didn't truly believe in it and didn't feel like the patients can get back to exactly where they were.
Absolutely. That's a really great point. So thank you. Okay. Another question for you, Dr. Bodson. If you don't mind just talking through how you prepare for transplant.
Sure. So it starts, really from the time the evaluation starts. It's a very multidisciplinary approach. Um, the whole team, meets the patient. So I consider that to start. So we're all preparing, we're all thinking about exactly, what we need to do to get this patient to donation. And on the recipient side, which is a separate team, to transplant. So there are two different, roles, and I'll get to that a little bit probably towards the end, but um, multidisciplinary meeting to go over all of the data. So, labs, the blood work, EKG, all the imaging studies, the CAT scans, the MRIs, going over how much liver, for each patient, how much liver is required to go into each, to a certain recipient. So all that stuff is part of the planning process. Specifically, as you move forward, we have a huddle prior to the actual transplant for liver, kind of a coordination to make sure everything's on track, everyone knows their roles. So it's a lot goes into it. And then for me personally, a little bit of stress. It's a stressful operation, and if it doesn't, I think there's something wrong with you. So that I look at the imaging repeatedly over, make sure all the measurements are still, even though we approve them. So really double, triple check, and really be familiar with, what we're going to do the next day. Have plan A, B, and C going in, and sort of alternate plans if things don't go exactly as planned. And then, the morning of, usually everyone's calm and things move along smoothly. So most of all the hard work is really pre.
Okay. Well, thank you. And thanks for walking us through that. All right. Next question here, Dr. Martinez, we'll turn back to you for a moment. This person's wondering, how can you maximize outcomes when finding a living donor?
So I think, and I guess I think all of us kind of alluded at some point, we really have to think, the recipient has to think broadly, isn't it? So we should not really limit the pool of potential donors. We always, again, rely on the family and closest friends first. But we should not really limit the recipient's opportunities to that limited pool. And again, it's really difficult conversation. People really don't feel like, telling the world that they're sick, isn't it? And they need help. And that is when I think, again, the ask the family member to be their champions, isn't it? To have somebody who can do it for you. So it takes out that stress of, telling everybody about you. We can help as a transplant center, again, referring to different resources and getting the information that is needed, kind of putting the recipients at ease, isn't it? They want to know, what's going to happen to the donors, what's the worst things that can happen, isn't it? And how the process goes, so they feel more comfortable themselves, isn't it? Asking people to do it. So we can definitely help with the appropriate education of our recipients, definitely our donors, and referring them to extra resources. So that's the way to maximize is think broadly. Don't limit yourself. Basically, anybody can be a donor.
Okay, thank you. All right. Next question here, Dr. Glorioso. This one is for you. Is there an age limit for a person who is receiving the transplant?
Yeah, so for kidney, we don't have an age limit. In general, if you're over the age of 70, you need to be relatively healthy over the age of 70. But every year we have at least one patient that's in their 80s that ends up getting a transplant. So age is really only one of the many factors that we look at in terms of someone's candidacy for kidney transplant. But we've certainly transplanted a few patients in their early 80s. When it comes to liver, our age cutoff is 75. So anyone over the age of 75 would be excluded.
Okay. All right. Thank you. All right, Dr. Thole, we will turn to you, and in just a minute or two, we'll turn to our live questions. But quick question here, why, or maybe not so quick, why is the transplant process so long?
Yeah, sure. It's a great question. So, transplant surgery is certainly a very complex operation. There's a lot of testing that goes into the process to make sure that all of one's organs are strong enough to get through this major surgery. So, your heart, your lungs are in good shape. We also really want our donors to feel comfortable that they've met our whole team, both to make sure that, it's a good idea for them to donate for both themselves and the recipient, and also so that they get comfortable with the number of different people that are going to be, seeing them after the surgery in the operating room, etc. At the end of the day, we want to make sure that this is the right decision, for you, the donor, and also for the recipient. At the end of the day, Jefferson, we all obviously feel very passionate and strongly about this, and we're going to take care of your loved ones essentially as if they were our own family. Second thing is only on the side of live donor liver transplant. Unfortunately, only about 33% of donors end up being a match for their recipient. So because of that, sometimes we have to work up more than one donor, or there may be multiple potential donors that come forward. And sometimes we start down one pathway and realize that there may be someone who's better suited. And that certainly adds to the timeline. In terms of trying to condense things from a logistical standpoint, we are in the process for the liver side of things to try to make a one-day evaluation process. It's a little harder to do with liver because there is more testing that goes into the process. But we really want to try to streamline it so that it's easy for our donors, where they can come in and have sort of a one-stop shop approach where everything gets done on campus in one day.
Okay, thank you. All right, Dr. Bodson, last question here before we turn to a few live questions from the audience. But this person says, I was on the transplant list for almost 2 years and the living donor was never tested. Why is that?
So another kind of tough question, because there's a lot of reasons that would be the case. So if someone said, they were going to donate, they really wanted to donate, there's a couple reasons why. So one, It could be that they decided that they didn't want to donate. It's a big, it's a big undertaking, and a lot of stress goes into it, and people may feel obligated. So there's a lot of reasons why, perhaps, but probably the most common reason is that some of the donors, unfortunately, are screened out, whether it's for age, different medical history, blood type compatibility for liver, for kidney. That's not really a barrier. For liver, it's a little bit more of a challenge. It's not a complete barrier. If there happens to be pairs, we can always, figure that out in certain scenarios, but it is much more of a barrier in liver transplant. So there's a lot of reasons why the donor can get worked up the whole time, and then kind of, there may or may not be communication about that. We have to keep that totally separate based on privacy of the donor and the recipient. So like I said, it's a little bit of a tough question to answer because it could be for many different reasons, and it could be this that donor decided not to go through with it, and they just had a hard time letting somebody know, and we certainly could understand that 100%.
Okay, thank you. All right, well, with that, I want to go ahead and just ask a few live questions. So what I'll do is just state the question, and whoever wants to jump in, feel free. Definitely just meant to be an organic conversation. So the first question here, if I donate my kidney or liver and later need to transplant myself, do I get any sort of priority or advantage?
So for kidney, the answer to that is yes. You move up, very high on the list. There's certain tiers of sort of priority when it comes to kidney. There's the wait time, but even above wait time is, sensitization. So I talked about a little bit before about antibodies to donors, pediatrics, and then somewhere underneath those, really highly sensitized patients, Dr. Glorioso and Dr. Martinez can probably answer exactly where, but it's somewhere in like the sixth tier, but waiting times are really, weeks to months at most for those patients. If that's roughly a guesstimate.
Yeah, I think for most, it's very rare that we have a donor that ultimately needs a kidney transplant. The most common scenario is someone that donated decades and decades ago, frequently when they were in their 20s or 30s, and now they're in their 60s, and just over the course of time, they've had worsening renal function. But when those cases do come up in general, because they're following closely with their primary care doctor and then ultimately a nephrologist, they're referred very early. So it's very rare that they would ever need to be on dialysis ahead of getting a kidney transplant. And once we get them listed in general, they're, again, outside of any limiting factors with antibodies, they're frequently transplanted within a couple of weeks.
Okay. Thank you. All right. Next question here. And again, whoever wants to hop in. Can you talk more about the benefits of living donation and why there is such a push for that option?
I'm happy to answer that. And certainly maybe some of my colleagues want to, chime in from the kidney standpoint. For liver transplantation, it's really challenging because unfortunately there are more patients who are on the liver transplant wait list than there are liver transplants to go around, which is of course, why we have a wait list. And that comes unfortunately with a real risk of becoming too sick to get a liver transplant and basically being removed from the wait list or the risk of dying while on the liver transplant wait list. And that risk essentially boils down to about 16 to 20%, which is not an insignificant risk. So I think live donation is one way that we look at, how can we advantage our patients? How can we give them every opportunity to make sure that we're doing right by them and getting them to our ultimate, shared goal of getting them a liver transplant. So I think that in my mind, that's really the number one benefit is making sure that we can get you to transplant and get you back to doing what you love most. Apart from that, there certainly are many other advantages because patients undergoing live donor liver transplantation are often going into the process at a much lower MELD score. They're going into the process healthier, they feel better. As a result, they don't have to wait as long, they don't have to get as sick, and their recovery on the backside is also much quicker as well. They're getting back to being on their feet, getting back to the things that they do love essentially a little bit more quickly. lastly, because of the way that we vet live donor organs so carefully, it's an assurance that you're getting a really good quality organ. And our surgeons, I certainly can attest to, and I have a lot of respect for them. They work really hard. Even the deceased donor list, certainly they're going through all the options to make sure that we can get the best options possible. But live donors tend to be younger, which in the world of liver transplant is always an advantage.
Thank you.
Yeah, from the kidney standpoint, is really similar to what Dr. Solly said for livers. First and foremost, or living transplants actually last longer, significantly longer than a deceased donor kidney transplant, to the point that it's double the time most of the time. So we say on average for a deceased donor, recipient is to keep and again, this is the median, and the overall population would be like 8 to 10 years, or living transplant can last double the time. So we're talking about, easily 15 to 20 years. Again, since this is a streamlined process, or donor is ready and our recipient is ready. So we maximize, again, a patient that is at that moment more optimized medically wise. Again, like the same as the liver patients or kidney patients come with many comorbidities. Dialysis, unfortunately, is a brutal process that actually makes the patient have an extremely higher risk of dying, isn't it, during that process? So we kind of definitely get the recipient completely optimized, since the kidneys, the kidney basically doesn't travel that much. It goes from one OR to the front OR, so the time outside of the body is really minimal. The kidneys work right away. Sometimes with deceased donor transplant, the kidneys may travel a little longer. The donors may have had some issues, around the donating, the time that they donate. The kidneys may not work specifically 100% right away. And so that adds to also the morbidity around the surgical time. So that doesn't happen with living donation. The kidney works right away, and the patients tend to, again, recuperate and do really well after the transplant. And lastly, they don't have to wait that indecent amount of time that some of our patients will have to wait on the list. Every year that they wait on the list, we add comorbidities and significant risk of mortality. So that is, from the get-go, one of the biggest advantage of getting a living donor.
Okay, thank you. All right. Next question here. Dr. Bodson, I will direct this one to you. Can you just talk a little bit more about the surgery themselves? Are they robotic or minimally invasive? Just any other details you can share.
Sure. For the kidney side of things, they're minimally invasive. Dr. Glorioso does most of the donors. She does them laparoscopically. We have done a couple of robotic donors at Jefferson, but we pretty much exclusively do laparoscopic. Pretty much the same. It's the same amount of incisions, if not less total. But with regards to the liver, it is an open operation. There are a couple places across the country doing robotic. It's the hope that we get there. We do a lot of our cancer cases robotically, but currently with the volume that we're doing, we think it's best and safest probably to just stay with the open approach for now, with the goal to switching over to robotic at some point.
Okay, thank you. All right. Next question here, whoever wants to jump in. Can you share just maybe anecdotally what you are hearing from donors about their experiences after being a living donor?
Sure. Go ahead. Go ahead, Daniel.
Sure. I think it's a great experience. I mean, overwhelmingly, donors are really satisfied and happy with their decisions. Certainly, they feel like they're doing this great and wonderful thing for their loved one. It's a positive experience. I think it brings people closer together. That's been my experience personally, and that's actually backed up by data and literature on the liver transplant end as well. They've actually surveyed large numbers of liver donors, and 95% of them were happy with their experience and certainly felt very good about it, and that this is something that they would do again.
Thank you. All right. Okay, next question here, a little bit more specific. Do donors need to take any medications after donation, either short or long term?
Sure.
So, oh, sorry, go ahead.
Usually, so for the liver donors, we send them out on a short course of anticoagulation to prevent blood clots, as that's been sort of one of the more common complications after transplant. Not everyone does that. It's kind of a 50-50 mix depending on who you talk to. So usually 2 weeks worth of that medicine, and really just some pain medicine to go home with for the liver donors. That's really all we send them out on.
Yeah, and the same from the kidney standpoint. They don't have to take extra medication when they go home. They go again most of the time just with Tylenol for pain management, and they don't have to do either a special diet, because that's another question that comes up. Okay, I need to take meds or do a special diet after kidney donation. They don't. They definitely don't have to follow any specific diet, and they're as healthy as they were from before donation.
Okay, thank you. All right. Next question here. If a child receives a liver transplant, are there restrictions in donating later in life as an adult?
Yeah, I would probably say that would be a restriction. Has it ever been done? I'm not sure. I don't believe so. Someone can certainly correct me, but I think that would probably be in the lines of we have to think about what's best for the donor, number one, and that would just be a more complicated, risky operation with blood vessels that really aren't compatible with the recipient end. So that's probably not.
I
Okay.
would agree with Dr. Bodson's comments.
All right. Next question here, Dr. Glorioso. I think that you were covering this a little bit earlier, but could you just talk a bit more about the compensation and coverage? Is this covered by the recipient's insurance?
Yeah, so the entirety of the donor workup is covered by the recipient's insurance. So none of the donor workup gets billed to the donor's insurance. Um, and if we have anyone that's interested in donating that isn't currently insured, ultimately there's a chance that something could come up moving forward, and we would want to make sure that they're able to receive health care long term. So our financial coordinators and will help to assist them with getting insurance if they don't. So from the health insurance standpoint, the entire workup and the surgery is covered by the recipient's insurance. And then again, we have programs in place to help with lost wages reimbursement, as well as reimbursement for travel expenses and child and elder care. There's some paperwork that needs to be completed to get those things done, but our social workers help our donors to get that filled out.
Okay. All right. Thank you. Okay. And our last question here before we wrap up for the evening, and just end with one final question that I have. But our last live audience question, this person says, if interested in being a living donor, what is the first step to take?
Yeah, I can take that one. So if you go to the Jefferson website, for the Transplant Institute, there's a link both for liver and kidney donors for anyone that's interested. And if you click on the link, there's a short form to complete with some basic medical history and demographic information. That then gets sent along to our coordinators for review, and they then reach out to you shortly with additional information. So it's quick and easy. And as Dr. I think Foley was talking earlier, a lot of the initial testing is done close to home with some basic lab work, and a lot of the initial consultations and discussions with our coordinators are done over the phone. So we send things by email, we call, whatever tends to work best for our patients. We can do daytime, we can do evening. We understand that, people are working and they have things going on in their lives. So, our team's available to help our, potential donors through the process whenever they need it.
Okay. All right. Well, thank you. For the final question this evening, I have one myself. So, what are your goals for everyone listening in on this webinar? And what would you like our viewers to take away from tonight? So, Dr. Martinez, I will go ahead and start with you.
Yeah, so basically, I think we all agree, and we will say that the main thing we want everybody to understand is that living donation should be the goal for every patient that is seeking kidney or liver transplantation. So that would be the first thing that should be crystal clear from the evening today. And then that we're here to help. We're here to help in the journey, educating the patient, educating the donors, help to debunk all the myths around living donation, and to facilitate the process. So we really want our recipients to be able to find donors. We want to expedite living donation, and then we're here to help.
Okay, thank you. All right, Dr. Glorioso, you're next.
Yeah, I just want to reiterate a couple points that Dr. Martinez said early on that I think are really, really important when it comes to kidney donation. One is that we have so many options with exchange that blood type incompatibility is not a barrier, antibodies are not a barrier, and location is not a barrier. So not only can you get your evaluation and workup done close to home if you live outside of Philadelphia, you can also you can donate your kidney elsewhere and have it put on a plane and sent to Philly for your recipient. So we've done this multiple times. We work really closely with other transplant centers across the country. And for kidneys specifically, if you've got family or friends or acquaintances that live elsewhere that are interested in donating, they can get evaluated at their local transplant center, and the kidney can catch a commercial flight, and the recipient at Jefferson can get transplanted. So, there's a lot of things that we think of that are potential barriers to living donor kidney transplant, and we work really hard to overcome those so that our patients that are interested and willing to donate are able to do so, and our recipients are able to get a living donor kidney.
Absolutely. Thank you for sharing that. I like the kidney catching a flight. All right. Dr. Thole, any final remarks?
Sure. I will just echo everything that my partner said already. I think live donor liver transplantation is really going to be the way of the future. The outcomes are better. We've talked about a lot of the advantages already. A couple other things. There are no silly questions. I would encourage all of you, if you have questions about live donation, please ask. We're happy to chat with you. Personally, I'm happy to have an appointment or sit down with anybody anytime to chat in more detail. I know it can be a scary thing for both recipient and donor to talk about. And we're here to make the process as easy as it possibly can be, truly. Other things, resources wise, I'm always really impressed by how much live donors know when they come down to sit down in the office with me. I'm always the first stop on the train, so to speak, and they already know a lot of great information. There are some really great resources that you can use online if you're thinking about live donation. I really like the American Society of Transplantation, or AST. They have a really great donor toolkit that goes over frequently asked questions. It's really detailed, it's well written, it's easy to read. So I certainly would refer anybody who's interested to looking at that. And then lastly, I just want to reiterate what Dr. Martinez mentioned earlier, that, even if live donation can't work out for you or isn't right for you for whatever reason, you certainly can still, help out your loved one by considering being a donor champion for them. So those are the key things I'd like you to take away. And I'm just very grateful for the opportunity to talk with you tonight.
Yes, thank you for joining us. All right. And last but not least, Dr. Bodson.
Thanks. Dr. Thole took one of my comments. Her last comment was exactly word for word what I was going to say. So it is really important. Like, if you shouldn't feel distressed if you can't be a donor, or if you decide you can't be, or you get ruled out. Take that opportunity to be a champion for your loved one or whoever it may be that you're donating to. And also, an opportunity, if it doesn't happen to match the person that you want to donate to, being a non-directed. All donors are altruistic. That's another thing that I think is a take-home point. It used to be that people would call them, altruistic donors are people who, donate to someone who's not related to them. But the reality is they're all altruistic, but non-directed donation is also a reasonable approach too, if you're interested. The other thing is, at least I like to take the take home message because a lot of recipients, the most common thing is when I ask, do you have a live donor is potentially, but I'm not going to ask them. And it's important to understand from the surgeon side of things, when I take that donor to the operating room, the donor is number one priority. There's three priorities in my mind. Number one is the donor. Two is the organ coming out safely. That's in a transplantable manner. And three is the recipient. It's not because I don't care for the recipient, because in reality, I still go over to the recipient side and end up spending the rest of my day there. It's really just to make sure that everyone knows that number one is the donor. So the safety of the donor is number one. So when, if there are recipients on here, I think it's important to understand that that's my job and that's Dr. Glorioso's job, is to take the utmost care of that donor so that you feel comfortable going forward with this. So I think it's a really important message.
Absolutely. Thank you. And a great final remark. So appreciate it. Well, thank you again, Dr. Martinez, Dr. Glorioso, Dr. Thole, and Dr. Bodson, all for your time this evening. I know such great information was shared. I learned a ton. And I want to thank you all for taking the time to attend and submit such great questions. So thank you. We will be posting an event survey, so you can let us know your thoughts. Any other specialties you would like to hear from, just let us know. If you would like someone to contact you directly to schedule an appointment with a Jefferson Health provider, please go ahead and fill out the last question in the event survey. To view this webinar and more wellness webinar series events, you can visit the Jefferson Health YouTube channel, where we have many more topics. If there is anything anyone here at Jefferson can do for you in this time of need, please reach out to us. Thank you once again for joining, and please be sure to stay safe and healthy. Have a wonderful evening. Good night.